Hello, everyone, and thanks to GE for this invitation to present during CIRSE meeting. Thank you for joining this presentation, and I will present how to plan, challenge, and identify the prostatic arteries during the prostatic artery embolization for patients suffering from lower urinary tract symptoms related to BPH. As you may know, BPH is a high prevalent disease resulting in lower urinary tract symptoms, and PAE, prostatic artery embolization, has become another successful and effective alternative of treatment for these patients. PAE is a technically complex for several reasons, as you can see here. And due to this complexity and variability in the pelvic vascular anatomy, and because DSA, digital subtraction arteriography, is limited by its two-dimensional nature, several excisions are typically needed to fully understand the vascular anatomy, which can lead to longer procedures and also more inject contrast medium to achieve all this DSA, and also increasing radiation dose, both for operations and for patients. So it is really important to understand all this pelvic anatomy and all the tools that we have to facilitate and to get better images and a better result. So in this slide, you can see here, and we can compare DSA here on the left to cone-beam CT on the right. Here, if you analyze this DSA, you will believe, you understand that you have an artery, a prostatic artery here, given the central gland and the peripheral zone branch. This artery, it could be an artery type 4. That means that it is arising from the internal pudendal artery. So it seems to be arising from this region. However, when we use cone-beam CT, that is one of the important information that we can get with this software, is that we can clearly identify that the origin of the artery, the prostatic artery, is much higher, and the origin is here in this position, and there is an overlapping of both arteries, and we see that the origin is here, is a long artery, and we can clearly identify. So there is a misunderstanding if you use only DSA, and that's one of the reasons that you should use cone-beam CT. Like in this other case, that when we are planning to identify the artery for its catheterization and to perform PAE in a good fashion. So here, we believe that artery is this. We understand that the artery could be an artery type 1 when it has a common origin with the superior vesical artery. Again, when we use cone-beam CT, we can clearly identify that the artery is arising from the inferior gluteal artery. So here it is the importance when we use this, because we can also rotate using different incidents, different perspectives, not only to identify the artery, but also to catheterize the artery. Here we can present what we have changed since 2019 when we got this equipment. We got a GE iNova 4100. It was installed in 2009. However, recently we got an upgrade that we have right now, the Embo ASSIST allowing Carnevale fluoroscopy roadmap. And with this, we got an optimization of imaging, and we have a really very nice workflow that we can reduce considerably the radiation to the patient and to the staff. What do we have changed? We changed the following workflow. Instead of getting aortoiliac arteriogram, instead of getting internal iliac arteriogram using DSA, you can see here that we only get a fluoroscopy roadmap with the pigtail catheter at the distal aorta. And once we have this roadmap, we are able to catheterize the internal pudendal artery, the hypogastric artery. And here in this position, when we have the catheter into the internal pudendal artery, we get a Carnevale CT. And the protocol that we have used is 2 cc per second, using a total of 22 cc's with an X-ray delay of 6 seconds. With this, we are able to identify the whole pathway of the arteries and also to identify the prostate distally, so we can get the entire image, the entire path since the origin of the artery until the distal prostate. And we can use that as a roadmap for navigation. And once we have the catheter, the microcatheter into the artery, the prostatic artery, we can get DSA, we can get Carnevale CT, and we can perform our embolization. And why this change in the protocol was so important? Because we avoided radiation. We saved time during the procedure because we don't get DSA anymore. We get only one Carnevale CT using this Vessel Assist software, and the result was really amazing. As you can see here, we got close to 57% reduction in the kerma and also 65% reduction in the TAP. It is a huge reduction, facilitating and getting better results. And here I will show you how to leverage Carnevale CT using the Embo ASSIST software. Here you can see when we get Carnevale CT, we can clear all the images and only keep our attention in the arteries that we want to use. So we can use the axial, coronal, and sagittal view and click in the prostate, and we are able to reconstruct the entire artery or several arteries that may be feeding the prostate, like in this case, that we have 3 prostatic arteries in only one side. Here you can see that we have this blue branch, we have the yellow, and we have the orange branch. And here you can see that we got this reconstruction in the path of the arteries, and also we correlate all these branches to the axial view and sagittal view, mainly to a better understanding of the prostatic arteries, and also using this with the software to catheterize the arteries and avoiding radiation, because we don't use DSA anymore to get these images. And here I can present to you our results when we evaluated 138 pelvic sites during 2 years from 2017 to 2019. We did a comparison with Carnevale CT and DSA, and we got an acquisition using the 5 French catheter, the guiding catheter, into the internal iliac artery. And we are trying to identify the type of artery and the number of arteries that we had in each patient. Also, we reviewed Carnevale CT in axial, coronal, and sagittal planes, and also we're in 3D volume rendering. And when necessary, we used the software Embo ASSIST. So the beautiful information and important information that we got here was that Carnevale CT allowed clear identification of the prostatic vascular anatomy in all cases. Also, DSA brought no additional information when we compared the two Carnevale CT. We saw that in close to 50% to 46% of the cases, DSA did not give correct information about the prostatic arteries. So this 46% that was different when we correlate Carnevale CT to a DSA were really important. In 23%, we were able to identify the type of prostatic artery classification by Carnevale CT. It means that it was not correct, the DSA information. Also, in 4% of the patients, we found that the main prostatic artery and another branch of the prostatic artery were identified using Carnevale CT that was not found using DSA. And Carnevale CT found and or correct a secondary branch that was missed during DSA in 19% of these patients. So, I also can show you that in Embo ASSIST was used in 17% of this case to improve Carnevale CT review through automatic vessel segmentation, and in 46% of these patients, it brought additional information compared to raw Carnevale CT. What about our concerns when we use Carnevale CT? Are we adding a high dose of radiation? So also we got information in 49 patients and using Carnevale CT, and we found that on average 2 DSAs result in higher dose than only one Carnevale CT. As you can see here, one DSA 66 milligrams compared to 106 milligrams, 106 milligrams when we use Carnevale CT. It means that when one DSA is not enough to identify the prostatic artery, the main vessel that we need to catheterize, and you have to repeat another DSA, it means that Carnevale CT is really more efficient in those.
So in conclusion, my take-home message is that if you want to perform an effective prostatic artery embolization procedure, you should plan the PAE procedure using Carnevale CT. You should be prepared for the challenges knowing the pelvic anatomy, specifically the prostatic artery anatomy, and also identify the target vessels using the Embo ASSIST software. With the help of these tools, you can deliver the appropriate treatment for your patients suffering from lower urinary tract symptoms due to benign prostatic hyperplasia. Thank you so much.